Well, welcome back, everyone. You know, stroke is the 5th leading cause of death and a major cause of disability in the U.S. Well, Lima Memorial recently earned the American Heart Association's Get With the Guidelines Stroke Gold Plus Quality Achievement Award for excellence in stroke care. Dr. Russell Maxon, Stroke Program Medical Director at Lima Memorial, is here to share more about this achievement. So thanks so much for joining us, Doctor.
Thank you for having me.
Yeah, so tell us more about Get With the Guidelines.
Sure. So Get With the Guidelines puts the expertise of the American Heart Association and the American Stroke Association to work for hospitals nationwide, helping ensure that patient care is aligned with the latest research and evidence-based guidelines. It's an in-hospital program for improving stroke care by promoting consistent adherence to these guidelines, which can minimize the long-term effects of stroke and even prevent death in some cases.
Yeah, so can you clarify maybe with us what this award in particular demonstrates about your stroke care process?
Sure. So this award recognizes our commitment to ensuring patients receive the highest quality of stroke care according to the nationally recognized research-based guidelines. The moment our teams recognize that a patient is having stroke symptoms, we are dedicating to getting these patients the immediate medical attention that they need, from testing and treatment all the way through until recovery.
Fantastic. So you've been recognized with the Stroke Honor Roll Elite and the Type 2 Diabetes Honor Roll Awards. So what do these recognitions mean?
So the Stroke Honor Roll Elite means we have met specific criteria that reduces the time between a patient's arrival to the emergency department and treatment with thrombolytic therapy, which is a treatment that can help us dissolve blood clots that block vessels and cause strokes. The Target Type 2 Diabetes recognition highlights our dedication to ensuring patients with type 2 diabetes who might be at a higher risk for complications of stroke receive the most up-to-date evidence-based care when hospitalized from a stroke.
Wow. So what should we know about preventing or maybe even getting treatment for stroke?
The biggest thing is know your risk factors. The biggest risk factors for stroke are high blood pressure, high cholesterol, diabetes, smoking, and obesity. You want to stay active to try to minimize those risk factors, which will in turn minimize your risk for stroke. The most important thing that we say is time is brain. So as soon as you notice you or a loved one is having any symptoms of a stroke, call 911, because the faster we can get you treatment, the better the outcome.
Well, Doctor, thanks so much for joining us. I really do appreciate it. And don't go away, because we got more when we return.